Children here, the chance before you were born, most likely you have ultrasound exam. So today, because of the time, I just show you the high level of the design improvement in ultrasound. So you can see on the right or on your left is the 3D ultrasound. That is improvement over the traditional 2D ultrasound. And then in the middle, you can see the cardiac image. And then the right-hand side is fetal Doppler, which record the fetus condition, so the doctor can monitor it. So this one is, so that's,
Hit unmute, sorry.
okay. Where's the mouse? Okay, yeah. So this is some illustration of the neonatal ultrasound. So I work with other team to design the transducer. So the radiology can hold it to scan the baby. There's a foreign hair here. It's a soft spot in the skull when they are young. And then in the middle, there's a Neo Doppler, which is a continuous monitor the blood flow to the inside the brain. So if they are normal, this is the image you can see. But if it is not normal, you can see they are quite different. So ultrasound can use for checking kidney stone, and if the liver is normal or not. This is a normal one. The other is fatty liver and abnormal liver. Okay, so my research actually before I joined General Electric, I found a patent. The name called automatic signal optimizing transducer assembly for blood flow measurement, which is using the ultrasound transducer put in the neck to monitor the blood flow to the brain. Like for example, recently I just found out some company have a similar concept during resuscitation, whether CPR or different way to if someone have some kind of emergency, they can put this monitor there to see if there's a normal blood flow to the brain. If not, then it's very dangerous. So I guess this one I skip because of the, you don't have sound. Okay. So how many minutes? 3 minutes. Okay. Yeah. So I just skip. So the piezoelectric effect, general ultrasound is almost 100 years ago, and I worked in General Electric before I joined the adjunct faculty in GCU. I worked with a team to come up with new single crystal. And this some of the paper I presented to improve the penetration of the ultrasound so you can see a better organ inside the body. Okay, so the new technology not only have a wireless probe, so you can hold it in your hand and send the image to your cell phone, but also some kind of fusion with the image fusion, whether using MRI or ultrasound. And the one I also mentioned, the patient monitor. So this is some of the amazing technology to demonstrate you can see the heart real time and 3 dimension. Okay, so beside ultrasound in medical, you can see that in the nature. So do you know the whales and dolphins use ultrasound to check if there's a fish so that they can capture? But the most amazing thing that is the bat. The bat generate ultrasound. Okay, so basically the dolphin use ultrasonic wave to hunt a technique called echolocation. So, but the bats not only have a good eyesight, but they can hunt inside complete darkness of the cave, so that detect a very small insects. So the research on the best echolocation can help improve navigational resources for the blind people. So it's amazing. So basically, when I look at the Bible, because I work as an engineer in the ultrasound, I can see the fascinating improvement. But when I look at the batch, it's such a small mammal. They can generate ultrasound, not only that, but they can move and capture the insects. So I would say, like Psalm 104, how many are your works? Lord, in wisdom you make them all. The earth is full of your creatures. There is the sea, vast and spacious, teeming with creatures beyond number, living things both large and small. Thank God for the creation, and not only for the animal, but the human being. Okay, thank you. Any questions?
What was the hardest thing about getting the patent?
Oh, okay, yeah. So I found the patent before I joined GE. Once you join the company, every invention belongs to the company. So I know that, so I had to fight with the time. So I spent half year to do the research, and the most difficult is I have not easy to write the patent claim because those are very specialized. So I had to hire a patent agent, not even lawyer, but they charge very expensive. Like 1 hour, maybe $100 or $150. So eventually I filed a patent, I had to pay out of my pocket close to $10,000. Yeah, and then I had to pay maintenance fee. So a few years ago, the maintenance fee, I forgot 2,000 or 4,000. I say forget it, I don't pay, let it expire and go for the public, so everyone can reference my research so that they can develop a new product to help the patient, to improve patients' health. So yeah, that's why. So that's a difficult part. So you have to, and the claim is getting longer and longer. That means people very easy to change something. So that it's hard to so-called override your. Easy for them to override, come up with some other things, so that it's basically difficult to get any commercial royalty, so-called. But for the sake of research and contribution back to the society, I'm glad to let other people use my research. Yeah.
Where do you see ultrasound going next? It's been around for quite a while, as you pointed out. What happens next? What are you seeing?
Very good question. One thing, just recently, a few weeks ago, I noticed there is a technology called histotripsy. That means some people so smart that they use the ultrasound in short pulse in microsecond to focus on the human patient for the cancer cell. They, instead of using thermal, they are using ultrasound generate the air bubble, mechanically remove the cancer cell. That's amazing. But you know, if they hit it in the wrong position, it's very dangerous. So that's why the one I showed you, the transducer, was when I saw my transducer contribution for the one in here. They need the one the curve away. They need this image transducer very accurate to position the target, so that the bigger transducer can focus into the tumor. So in that case, the success rate is very high. So people used to have liver mass, it's difficult to open the surgery. It's non-invasive, non-radiation. So it's improved the healthcare tremendously. That's one thing I really appreciate. And I saw my product, one of the product, of course, teamwork, that was used for the imaging mechanism to assist the doctor to make sure it hit the right target, not the wrong position. So that's one of the examples. There's so many example. Patient monitor, I mentioned that before. You can continue to monitor the patient's health. That's my pattern that I showed you before. That yeah, this one. So it has so many applications. So you can monitor the this one, the Doppler for the baby, because I went to a neonatal unit. Sometimes you see the baby premature, you can put on your hand. But if you continue to monitor them, make sure they're healthy, they have a higher chance to become normal. Okay, thank you.
Thank you.
Thank you, Ellen, so much for your research. We would also like to extend our warmest welcomes to the Provost, Dr. Gibb, and Dean of Student Affairs, Dr. Griffin.